Okay, now we're going to welcome Dr. Terri Turner. She's a medical doctor and an herbalist, and she uses the integrative medicine approach and osteopathic manipulations to treat her patients. And she's especially adept at diagnosing and treating Lyme disease, fibromyalgia, chronic fatigue, and illnesses that relate to neurotoxins found in mold. She uses a hands-on approach to reduce pain and is truly passionate about helping to create healthy communities. Dr. Turner teaches a lot, and she wants to teach patients to understand the mind-body connection and how we can blend the Western medicine approach with other methods of healing. Her class today, her presentation, if you will, it will cover herbal aids for immunity, which is totally appropriate, and also to prevent and support symptoms to go through these times of exposure to viruses. Okay, so Terri, are you there? Okay, we're going to have to unmute Terri. Let's see if I can do this. No, I can't. Terri, can you unmute yourself? Okay, I'm going to ask the tech team in the background. Okay, techies, you can hear me. Can you unmute Terri? Okay, I guess it will take a little while. All right, they're working on it, and we're just going to wait for Terri to come in live. And yeah, I mean, a general apology for everything what has happened will happen or may not happen. The internet sometimes is unstable, although we have an incredible connection here at the KLG studio, but still, you know, nothing is perfect. So we're doing the best we can, and that's the best we can do. And while we're waiting, I also want to share in regards to nettle, which is also one of my favorites, and the poison oak issue. There are truly other remedies that may be a good fit for some people. And I say that from personal knowledge because I used to be highly susceptible to poison oak, and it used to take forever for me to heal those lesions. There is ways to make it better. So just go and inform yourself. And there she is. Hi, Terri.
Hi. Boy, that took a while. Can you hear me?
It's okay. You're there and we can hear you. Can you hear me?
Yes, I can hear you.
Okay, Terri, it's all yours. Take it away. I'm going to mute myself.
Okay. Hi. I don't know if you can see me, but I'm Dr. Terri Turner, and I'm an osteopath and an herbalist.
Yes, I can see you, Terri.
And a professor. And so I want to add a little bit to what you said, Claudia, because I think a lot of that is true. And I actually also am very allergic to poison oak. I actually was fishing in a lake when people were burning it around the lake and got it all over my hands and ears because it missiles in the smoke. So it's actually a really difficult one to get rid of. From a medical model, mostly they'll throw steroids at you. From a non-medical model to start with, they actually recommend Technu, which is or something that has some oils in it, because it's actually the oils that are what get you. And so Technu is one of those products that you can actually use to kind of get the poison oak off you. But there are everything from immune treatments, herbal treatments, definitely, if your genetics are a histamine responding genetics, then you may be more susceptible to it than most people. And so turning off your genes that make you go into a histamine response can be very helpful. And we can even use frequencies now. I actually went out and got into poison oak and took a decadron, which is what we use for tumors of the brain, and ended up then using frequency specific microcurrent, and it went away for a week. I used frequency specific microcurrent one more time, and an outbreak that usually would last a month to two totally went away without any more steroids. So there are lots of different ones that you can actually use. So let's see if we can start on the mysteries of immune system from an herbal approach, not a Chinese medicine approach, but more of a Western medicine approach. And I just want to reiterate one of the professors actually at UCLA who did immunology. His big presentation was really that microbes and viruses are going to become kind of a huge issue for us, and learning how to use them for good things, as we do in permaculture and an oogle pile, versus growing herbs that actually can help us manage them so that they don't activate us when we don't want to be activated, is very useful. And I think that's part of what herbalism has to offer, because we're running out of antibiotics, and most of the time the antibiotics don't work on viruses at all. So to start with, I want to talk about transmission. You probably have gotten really used to hearing this all over the news and in every email that you get, and talking about hand washing at least 20 seconds. Usually if you've got something that's got a alcohol base or a soap base or a thymol base, those are what really get to bacteria and the viral envelopes. Covering your nose and mouth. The kids are being taught this even in school now. So they're supposed to sneeze into their sleeve and make sure that they can actually not send something around. And as you all have realized, I'm sure we're all using masks. And especially if you're sick, even though it's not comfortable, it's worth it to consider wearing a mask or something so that you don't give it to your entire family or anyone around you. We're kind of in a low COVID area right now, but I can't promise that's going to last. And so staying at home is part of that. Also removing it from surfaces. So you'll notice even in every situations, the grocery store, everywhere else, they're all cleaning the surfaces frequently, trying to get rid of contact transmission. And viruses and bacteria have both of those options of droplet and contact. And then the 6 feet apart has actually been something that we've known even since the plague. They would isolate people who got different infections even in the olden days, and try to limit the infections as much as they could. They even put them in special boats and out in special areas, sadly, which often didn't help those people recover, but it at least helped the people that possibly might get the infections themselves. We have immunity, and we have the innate immunity and the adaptive immunity. Innate immunity is what we're born with. Although part of that I want to add is also children, when they're being breastfed, you actually get all of the antibiotic or antimicrobial or immune system in breast milk. And so for a period of time in our country, they really encourage people not to have breastfed children. And now they've actually acknowledged that if you can breastfeed your child for at least 6 months to a year, actually their immunity is way better. One other thing I want to mention around that, though, is the interesting part is when a child is born vaginally, they get all of the microbes that the mom has in the process of going through the vaginal vault and being delivered. And when a child comes from a C-section delivery, they don't get all those microbes. So we're now finding that dysbiosis and problems with our abdominal flora actually also relates even back to that very moment when we're born, on whether we were C-section or whether we were vaginal delivery. The two cells you'll hear people talk about are T cells and B cells. There's a way that we sequester in our lymphatic system and make antibodies, and then the lymph nodes and the spleen help actually filter those out or activate immune systems. when we first have an infection, you might hear someone say, oh, you don't have any IgG. IgG is the first antibody we form, and the secondary antibody we form is what we call an IgG. So IgM and IgG. IgM is first, IgG is second. IgG is what gives you the long-acting immunity, and that's part of what we're talking about even with COVID at this time. We develop immunity, especially with the IgG, due to exposures. Other kids have it. We've eliminated a lot of the microbe infections and viral infections, and we now have vaccines. But if their best friend gets mumps, the chances are really high they may get mumps because they are contagious. So, and then the other is actually having a vaccination or something that gives you a microinfection. That we started with polio. We actually used a similar to polio vaccine, cowpox, so that we could actually get resistance to polio itself. I'm going to go through this just a little bit to show you where these things start with the adaptive versus the innate. The one last comment I have around that is that when we look at the formation of B lymphocytes, antibodies, defense cells, and T lymphocytes, how we kill them, how we protect ourselves, how we deal with the first attack, these are things that our body has done for centuries to change our body cells against specific pathogens. So these have been formated from these kind of exposures. That's been one of the hard things, in that when different groups of people move from one continent to another, oftentimes they carry their immunities, but they also carry those pathogens. So we notice that sometimes it targets groups that haven't been exposed to these. We're finding that a little bit even with the Native American population with COVID as well, that there are certain groups that tend to not do as well with certain pathogens. And it skews who gets it and who gets it really in such a severe manner that it could be life-threatening. Things that you can make, that you can do yourself to make yourself less susceptible to illness. The more you're stressed, and this of course is stressing everybody, the more you produce cortisol, the more you activate your adrenals, and this can actually suppress your white blood cells and antibody formation. We have noted that a lot of the people that are getting, especially COVID, but I want to talk about all infections in general, if they have vitamin D deficiencies, zinc deficiencies, which we think about a third of the population have, vitamin A deficiencies or vitamin C deficiencies, it sets us up to get more infections. So those are some of the things we're encouraging everybody to do through the flu season, to do with COVID. I'll talk a little bit about dosages as well, but zinc actually makes the strep and bacterial infections susceptible. If you're low in zinc, the vitamin A does phagocytosis, and I'll show you a picture of that. And vitamin C actually helps make you less susceptible to microbes. Things that you may not be aware of that could also make you more susceptible is pre-existing medical conditions or your own genetics. If you've had your spleen taken out, that actually puts you at higher risk for getting infections. If you tend to eat a lot of sugar, that actually blocks vitamin absorption. If you have dysbiosis, or what we call leaky gut syndrome, and your microbiome has actually been altered, it actually leaves you at having a higher susceptibility for viruses or bacteria as well. And it also can actually decrease your secretory IgA, so that you actually, even swallowing those microbes, they affect your tissue of your gut and actually progress to becoming other infections inside of you. Specific genetic pathways can do it. I'm going to list one specifically. There's a group we call the hemochromatosis group. It's a very common in the US. It came over from the bubonic plague in Europe, especially, and it's a genetic issue where you sequester an iron. Microbes and viruses like iron. So it made those be put in different organs, pancreas, heart, liver, and it actually made the people with hemochromatosis survive the bubonic plague. They then moved to the US, And we actually have a lot of people who have hemochromatosis here in the US, but it does put that iron still in your pancreas, your liver, and your heart. So those people usually have diabetes. They often have fatty liver disease. Um, and they also end up having issues oftentimes with their heart and getting congestive heart failure and heart disease way earlier than other people. These are the kind of diagnoses you'd want to be evaluated with 23andMe or one or of its equivalents, or a physician to see if it runs in your family. And if a family member goes into the hospital and has that cluster of symptoms, they may diagnose your grandfather or your mother, and then they'll ask that the whole family actually get diagnosed to make sure that you do or don't have hemochromatosis. Histamine and inflammation responses. Some people, when they get any kind of infection, they react way more significantly. They have mast cells that release histamine, just like with poison oak. You actually have full body responses. You may have joint aches, muscle aches, skin blistering, things way beyond what maybe your sister or your neighbor might have, even if they are reactive and to the same poison oak. And so part of what we're now doing in genetics is really looking at how we can tone those down to control them, not with biologics, which is what the pharmaceutical companies want us to do, but actually so that we can make our allergies a little less revved by using our genetics and supplements to try to suppress that. If you have hypertension, diabetes mellitus, lung issues, or cancer, high blood pressure, if you are certain races, you're more susceptible to different infections, or if you have a low white blood cell count, which is called leukocytosis. Stress, one of the things that, and I borrowed this from my friend Dementia Clark, is that part of stress is you and how you handle life. So learning how to use those kind of things that can actually make your life better and make you enjoy life sometimes are really simple. Could be going through the comics, watching a funny video, watching comedians, dancing, singing, exercising, getting out in the sun, having sex, making art or writing, going out into the fresh air, just walking around your house, even if you're sequestered in your house, making sure you get enough sleep. Call or Zoom and connect with all those people you love just because you haven't talked to them for a while and they can't come over to your house. And even meditation has actually proven that if you can affect the adrenal axis of stress and decrease your stress, you decrease your catecholamine response, you improve your immunity. It's incredibly. I want to talk a little bit about herbs that decrease stress. I didn't give the dosages on these because that's kind of a very specific thing that you should use a herbalist with. But if you are going to try these yourself, always start very low. You can have allergic responses or reactions to herbs that you're doing yourself, just like you can have them to foods or medicines. And oftentimes your phase 1 and phase 2 liver cytochrome P450 system that you can get on your genetics, all of the herbs actually fit in there just with pharmaceuticals as well. So if you have certain areas that you have SNPs that make you more reactive, you can react to herbs just like you can as a medicine to regular pharmaceutical medicines as well. So violet flowers, skullcap, cramp bark, wood betony, stackies or horse mint, hops, valerian, lavender, St. John's wort, catnip, motherwort, chamomile, milky oats and oat straw, kava, passion flower, linden flowers. These are all very common herbs that are often in stress formulas or can be taken individually. If you are a sensitive, please, please, please only try one at a time, because if you react to that, then you'll know exactly that this is what's causing the reaction. All of these also have multiple different other categories that they can be used for. So some of them give improvement in constipation. So if you tend to have diarrhea, that actually may give you diarrhea. So if you're going to take an herb, look the herb up. look and find out what category it's in, what other actions it has, to make sure that if you're the kind of person that has other side effects of things in your body that are working or not working, that this herb is not going to get you in trouble with one of those in activating one that you already have. So when you're learning herbs, oftentimes I encourage people to actually do trials on themselves, get the feel of the plant. Try one herb at a time. See how you do with that herb. See what the spirit of the herb or how the essence of the herb talks to you and how it feels in your body. Because there's definitely some that your body's going to really like, and there's definitely others that you're not. And if possible, work with a trained herbalist, because they know all of those things, so they can do an herbal symptom survey and match the right herbs for you and make sure that you don't get those kind of reactions and side effects. Vitamin D3, even if you just stay out in the sun for 15 minutes, your vitamin D will actually go up. They recommend it at least 3 times a week. You can also use fish liver oil. It will give you both vitamin D and vitamin A. The dosage usually is 500 milligrams to 5,000 milligrams per day. Fatty saltwater fish. But be aware that if you're a person who has darker melana in your skin, your chances of being low in vitamin D are actually much higher. There is some concern that this may be part of what is affecting Hispanics, Latinx, even our native population, in their vitamin D's being low and they don't even know it. So they often tend to have to take a vitamin D3 supplement to maintain that. What herbs have vitamin D? Horsetail, nettle, and parsley. Zinc. You can get zinc yourself from just your diet. Pumpkin seeds, some meats have zinc, legumes, in all the legume family, and zinc is needed to actually absorb enough vitamin A and E. Usually, zinc dosing is taking 30 milligrams daily if you're doing it artificially. Vitamin A, fish liver oils, we talked before, animal livers, green, yellow fruits and vegetables. This actually is a great vitamin for enhancing immunity, for colds, influenzas, infection of the kidneys, bladder, lungs, mucous membranes, and it's an antioxidant. So you need vitamin A to process with protein in order for it to work properly. Doesn't have to be meat. It can be vegetable and plant proteins as well. Be aware, though, vitamin A is a fat-soluble vitamin, so you can overdose on vitamin A. So you don't want to take more than 20,000, what they call IUs, international units, daily. Vitamin C, you can find it in citrus, rose hips, those little balls that come at the end of roses after the roses have gone, hibiscus, fir tree tips, violet flowers and leaves. And usually you want to take 1 to 3 grams, even on a daily basis. And if you get sick, you should actually increase that. The one thing about vitamin C is if you're taking too much for your body, it will give you diarrhea. So be aware that you go to bowel tolerance. And if you're starting to get more sick, take the amount smaller and spread them out during the day. So instead of taking it in a large dose in the morning, take it 3 to 4 times a day and smaller amounts, and usually your gut will tolerate that as well. So that's an individual thing. Why do they say don't eat sugar? The reason they say don't eat sugar is because acidic versus alkaline is part of how our body balances all of its organs and functions. Now, usually our bodies are slightly acidic. 7.0 is right in the middle, but 7.49 is slightly alkaline. That's where we hang out. Sugar is very acidic, and so it actually can lower immunity. And there's a lot of concern that if our sugar levels are really high, our yeast and Candida love to have sugar around. It does alter phagocytosis. Here's what phagocytosis looks like. So a virus comes along, it attaches to the receptor on a cell. The cell itself invaginates and kind of surrounds the virus, and then it makes it into what we call a phagosome. With all of that, then we end up getting our immune system coming in to try to destroy this virus. or make antibodies to this virus. It's sequestering it inside of itself. I want to talk a little bit about things besides COVID. And actually, right now, COVID is predominant, but there's a lot of other things that have happened to us for years. And so you can distinguish how a doctor thinks about it versus how someone who's not a doctor thinks about it. The common cold and flu is most commonly viruses. There's some people that estimate it's somewhere around 3,000 different viruses, but some people say maybe even up to 3 million viruses. Usually you only get one of them once, and you don't recurrently get the same virus. It usually affects the lower and upper and bronchioles of your lungs. I'll show you a picture of what that looks like. And there really isn't any treatments for these except exactly what we just discussed. All of those things tend to really help when you have a common cold and flu. So getting antibiotics don't help. Sinus infections tend to be more bacterial or allergic. Bronchitis is the tracheobronchi. Asthma is the bronchial spasms around the mucus that makes you not be able to absorb oxygen. Walking pneumonia is usually a viral infection. Pneumonia is usually a bacterial infection. And COVID is a viral infection that gives cough, fever, fatigue, difficulty in breathing. It also increases fibrosis in the lungs and gives you low levels of oxygen. It's called hypoxia. Here's what the lungs look like. Here's the little bronchuses going down, alveoli. They look like little cauliflower or broccoli bubbles. And that's where we actually do the exchange. The capillaries exchange the oxygen there. So before exposure, what they're really talking about is avoiding weakening your lungs. If you're a vapor, if you're a smoker, if you're a person who cleans, so your lungs are exposed to chemicals every day, try to avoid the exposures. Remove all the toxins that would decrease your immune system. Try to decrease inflammation, especially with diet, which we just talked about. They are recommending, they did do a study on regular viruses, and NSAIDs did have a higher viral load when you took NSAIDs, but for COVID, they've actually realized it makes it worse. Things like quercetin, luteolin are all anti-inflammatory, so you can take those. There's a couple of great papers in terms of protection. One of the things they're talking about is the use of ginger and licorice tea. There's cilia protectors to try to help with the cilia-like structures that in the lungs themselves, so they don't actually get pneumonias. They're now actually talking about bioflavonoids, specifically from peppers, buckwheat, buck currants, and you need to take at least 2 to 3 grams daily. Increase them and increase the frequency if you actually are having an infection at that time. Bromelain, which is from pineapple, and vitamin C can also enhance these as a combination. Omega-3 fats, raw nuts, seeds, legumes also make the body be able to make new cells, and any unsaturated vegetables, oils help that. Make sure you're doing, you can do steams, you can do neti pots or crock pots, essential oils, non-ionized salt, warm water, golden seal, Oregon grape for sinus infections, drink teas, mullein, vitamins, all of these things that we've actually already mentioned. Seasonal allergies tend to be more of an allergic reaction. And that's this. Herbs for demulcents are this list here. I made this so that we'll put it on the website so you guys can look up what the demulcents are. Relaxing expectorants, which help coughing for any kind of infection. This is a list of those that also will be on there. These are actually herbs that fight anti-infective or virus or bacteria in the lung. And that will also be on this. Liver support helps everything keep moving in the lymphatic system because everything drains through the liver. So these are all liver support herbs. And adaptogens, which help the body adapt to stress and the physical accepts. So go to the basics, go to nutrition, eat your dark green leafy vegetables that your parents were always on you, nettles, bamboo shoots, cabbage, beet tops, Beets themselves, carrots, yams, onions, garlic, ginger, cayenne, horseradish. This is an article. I will add the notation before we mount it on the website. That was a kind of an interesting article I found in terms of talking about how COVID specifically works on it. They've been doing some research on that. And what they specifically mentioned with COVID was ginger and licorice, Japanese knotweed, elder, or Sambucus nigris, astragalus, reishi, and turkey tail. They have had some luck with silver hydrosol, which is actually aqua silver or argentum. You can usually get that from some of the practitioners or sometimes at some of the health food stores. Avoid sugars, rest more, and make sure you wear a mask as much as possible and keep that 6 feet from everyone else. Any questions?
Wow, Terri. Now, that is so much information. Now, we're going to make sure we are going to upload all that, especially the last two, their slides you talked about. We're going to make sure we get this all on the website. Can you hear me?
Yes. So the slides didn't work at all? You guys didn't see them?
But hey, that's all great. We're going to load it up because honestly, who can retain all this information you just gave us? So this would be an incredible resource to refer to again and again, because you covered so much, which I mean, there's a lot of points I myself am passionate about. You addressed the acid and alkaline spectrum, which is so critical and nobody talks about it. You also talked about finding out how we respond to natural medicine. That goes for the other medication as well, rather than just taking too much. We have to wait and see how we react to one particular substance at a time. So I believe what you said. Once we get a feel what works for us, then we can go into the whole area of having synergistic treatments. But yeah, I like it what you said. Keep it simple. Keep it simple. Yes, very, very good. So there's some wonderful comments. Yes, I think we're going to have to put up this slideshow as soon as possible. And you have a very unique knack of combining traditional understanding with modern research. And this is really exactly what the times call for, that we can apply everything we and all our ancestors have learned so far into what we need to do now for all the new diseases, if you will, that we are encountering. And that started at the turn of the century. And I know you were critically involved also to finding out more about what then was called SARS and MRSA, and now COVID really is SARS. Is that true?
It is a form of SARS with has a few unique additives to it.
Yes.
It's specifically a coronavirus SARS, which has these very distinctive receptors that actually give it a ring look, which is why they're calling it corona. And usually they go through bats and some other animals, but they can mutate and become human interactive.
Yeah, obviously that happened. And thank you for mentioning sugar. Now, I talk about sugar a lot, and actually there's some people that don't talk to me anymore because of my
and I love sugar too, but
there is something going on with refined sugar that really makes it difficult for the body to deal with other things that come in. Is that a fair thing to portray it as such?
Yes, it is. What we're actually noticing is that, especially with the artificial sugars, they use different receptors compared to the natural sugars. Even if you make a vitamin, let's say, that's not made from natural food sources, normally sugars are in a right configuration. And when you make artificial sugars, they often are in a right and left configuration because they're artificially made. So Sugar definitely does interrupt that, and actually people can have allergies or reactions to the different types of artificial sugars as well.
Yes, they can quite what's the saying? Wreak havoc on the system, right?
Yes, my son was very reactive to sugars, and so we one of the things we talk about, the acidity and the alkalinity. Inflammation, usually if you're going towards the alkalotic spectrum, you'll do better. So we used to use Alka-Seltzer Gold, which is sodium, it's Alka-Seltzer, but it's mostly sodium bicarbonate citrate. And we would put it in some water and fizz it, and he would drink it, and all of his reactions would stop because we were alkalizing him.
Exactly.
So you can even do it with baking soda. And it's also a molecular technique. Yes, and what it's really doing is making you more alkaline. And it can be repeated as you need it.
Yeah, that's excellent. Now, we have questions coming in, Terri. So
Sure.
first of all, of course, I want to mention your website. It's territurnerdo.org. And
Yes.
You have a private practice now in Ukiah. Can you share the address of your practice?
Sure. I'm at 620 South Dora. It's actually right near the Women's Cancer Resource Center. And it's down where the hospice is, down in the bottom of the building. So for Ukiah. So it's in number 102E in Ukiah.
All right. Excellent. And we have another question coming in. I don't know how deeply you want to dive in this one, but here it is. When dealing with an acute situation and introducing a new herb, how do you deal with the risk for allergic reaction? In other words, how do you start with a slow and low dose when you want to attack an active infection?
So if you've done 23andMe, you can actually look at your CYPs, and there are charts that I can give you that actually have the herbs on the receptors for each phase 1 detoxification in your liver. So they're in the categories just like all the medications are. So if you have SNPs in that line of receptors, that might be one that you might be more sensitive to. So it's not as simple as traditional medicine wants to make it. But the next way is I'd say always start very low and slow. So making it into a tea actually is a way more diffuse way of doing it versus starting yourself with tinctures and the dose that are on the label that says you should take a dropper full. If you want to actually try 1 drop of a tincture, that's a smaller dose. If you have a reaction to that, you actually may want to put 1 drop in a quart of water. So that's a dilutional technique that you might find that you don't need very much of it, but you can actually still keep doing herbs that you might be reactive to, or find that doing microdosing actually sometimes can be just as effective as using large amount of dosages. It depends on your sensitivity. So usually doing herbs at least every 3 to 4 times a day if you have an active infection is the way to go anyway, versus trying to give yourself a big dose once a day, because herbs aren't time released. So they don't do like pills that, they're designed to take once a day, or a vitamin once a day. So doing small amounts of herbs, and oftentimes you'll see in some of the different formulas that doing a dose every hour, small amount, can be increased kind of through the early parts of the infection. I want to mention the American Herbal Guild website, and they actually have a COVID resource page, which has probably 100 different herbalists, Herbals Without Borders, a lot of the people that have done all the Bruner, who does herbal lime, all of those have written articles specifically for COVID, and have written articles on basic treatment protocols. And everybody has their favorites. So there's not an only way to do this. We are trying to figure out what are the better herbs for specifically COVID, because we're in the midst of COVID. But oftentimes you can use a mix and match of these herbs for even Biden's, some of the local herbs that we have here are really great for infections. So even growing some of these herbs in your own backyard, as we are learning from Donna Tierra and some of these other things, echinacea can be grown. All of these things you can actually make yourself and do teas or tinctures and learn how to do that. So you can actually make it very accessible. And sometimes having an herbal first aid kit so that you can actually have small amounts of different herbs when things start happening, looking up, oh, my herbal first aid kit has echinacea in it. How do I use it? Okay, I'll start with that one because that's what I've got. Let me see if that clears my urinary tract infection or my mild cold that I'm starting to get. The only other one that actually I didn't list on here and I forgot to is there was a really great herb. Oh, good. Now I'm totally spacing its name. That actually was from Nevada. There was a native herb, Lomatium, and it was very, very successful in the 1918 flu. And it is on the list from some of the big herbalists that Lomatium may have some good long-term effects. I find people that keep getting repetitive infections, that even starting with elderberry or elderberry wine and taking it through the flu and cold season helps boost their immunity through that time. So taking just a little dose of that on an ongoing basis helps bring it up. But you can actually then, if you're having repetitive infections, add Lomatium to it. And oftentimes that fatigue that lasts 6, 8, 3 months, you can actually cut it dry and get everything else restarted. So it can be very useful.
That's very helpful. Yes, that's a lot of information you gave us. And I so embrace also the understanding of less is sometimes more, the microdosing in regular intervals rather than almost, I would say, overwhelming the body with this like dozens of natural remedies, but how can the body actually process them and really find its way to deal with them, while maybe only a third of them are really beneficial at that particular time. So yeah, that is very helpful. And
well, and even with C, if you take too much C at one time, you get diarrhea and then you stop taking C.
Right.
So taking small amounts of C, and they actually decrease reactive oxidative species and all of the inflammatory cytokines that are in your body from infections. So you need to actually kind of keep reboosting that through the infections. That really makes the big difference in you getting through infections faster.
Great. Thank you so much, Terri. We're almost out of time. Any closing words?
Be conscious and healthy, wash your hands, and really take care of you. And oh, there's one other interesting thing, and I'm going to try to actually mount a video on it. Lymphatic treatment is really great for colds and flus, and the osteopaths actually did one that they taught their patients and their families, and it made the 33% of people that died with the pneumonia from 1918 actually go to 10%. So I'm going to actually put that up as a YouTube video so that you can learn how to do it on yourselves through the midst of this COVID time period.
Where can that be found then?
Pardon?
Is it on YouTube?
It's not yet, but I'm getting ready to videotape it. I looked for it, and so it'll be on. And if you want to look up my name on YouTube, you can actually see the lymphatic treatment.
Thank you so much, Terri. Thank you for being here. Sure. And there's so much to learn and to study. Thank you, and I'll see you soon.
All right. Take care.
Bye. Bye.